Hi everyone, I'm Sakamoto. Continuing from the previous video, I will explain the tips to select regenerative medicine. Last time, I told that quality and quantity of stem cells are important for stem cell regenerative medicine. Today, I will explain the tips when injecting stem cells more than once. Only one stem cell injection is significantly effective, but multiple injection is also used sometimes depending on the symptom. However, the efficacy will vary by the preparation method for multiple injections. First, about the preparation method of cells in a typical cell processing room in Japan. Once the fat is collected from the patient, stem cells for 3 injections will be prepared. A number of cells are cultured at one time and kept for each injection. They are all kept in a frozen state. Upon first injection, stem cells are transferred to hospital, clinic, and thawed. As I told last time, they are less effective after thawing. Cells for next injections are frozen for a longer time, so the efficacy becomes even weaker. The longer the cells are frozen, the weaker the efficacy becomes. Meanwhile, here's the method at our partner cell processing room. This culture method is rarely used in Japan. Collect the fat from the patient and culture stem cells. They are transferred to our clinic without being frozen. This enables to obtain stem cells with more than 95% viability. Prior to second injection, stem cells are cultured again as the first injection. They are also transferred to our clinic without being frozen. The same process will be repeated for third injection. In this method, lively cells with more than 95% viability can be injected each time. Of course, the preparation method at our partner cell processing room requires time and effort. However, it enables injections of lively stem cells all 3 times, unlike when using a typical cell processing room, resulting in high treatment outcomes. In stem cell regenerative medicine for knee, hip joint, or shoulder, it is important to prepare cells in a large quantity. Injecting lively stem cells without freezing, namely, the quality of cells, is also the key. When injecting more than once, the key is to prepare lively cells each time. At our clinic, the patient's fat will be cultured with the patient's own blood. In Japan, they are most commonly cultured with animal blood, such as cow. However, using own blood is a safe option as it eliminates the risks of allergy. In addition to the quality and quantity of stem cells, today I introduced the preparation method of stem cells for multiple injections. Thanks a lot for your attention!